Let's move to the fifth and final section of our topic, and this section is about squamous papillomas. And in this we will talk about the juvenile papillomatosis and adult onset papillomas. So squamous papillomas of the larynx are further divided depending on at what age they develop. We have juvenile, infantile type of papillomatosis, adult onset papillomas, and also in this section we will discuss about how they present, what are the symptoms associated with these, how we diagnose these papillomas, and what's the treatment of the squamous papillomas. So juvenile papillomatosis, these are the papillomas present. So here you can see very clear, nice picture of the papillomas. So juvenile papillomatosis. Most common type are the juvenile papillomatosis, and these papillomas are caused by HPV, which is human papilloma virus, DNA virus type 6 and 11. So DNA virus type 6 and 11 of human papilloma virus, which leads to cervical cancer, and also viral warts can occur as a result of HPV infection and human papilloma. So that's the causative factor in this juvenile type. Affects the supraglottic and glottic region of larynx, subglottis, trachea, and bronchi. So all these different regions are affected. All three parts of the larynx, glottis, supraglottic, subglottic parts are affected. Then it can extend to trachea and even bronchi. Vaginal HPV in mother, usually it is inherited in the fetus. So that's the mean of transfer of human papilloma virus. If in mother is infected, it can go to the baby with the vaginal delivery and cause infection in the infant and leads to juvenile papillomatosis. Children who had tracheostomy for respiratory distress due to laryngeal papillomas. High risk of tracheal and stomal involvement owing to seeding. So children who had tracheostomy, they are prone to develop juvenile papillomatosis also due to laryngeal papillomas. High risk of tracheal and stomal involvement occur due to the seeding. So the children who had tracheostomy for respiratory distress can have the problem. Virus particles in cells of basement membrane of respiratory mucosa, HPV virus is present. Widespread involvement and recurrence is common in patients with juvenile papillomatosis. Symptoms and diagnosis, we have hoarseness or aphonia. Hoarseness of voice is present or completely loss of voice, aphonia, respiratory difficulty or stridor. Diagnosis is by flexible fibreoptic laryngoscopy, direct laryngoscopy, and by the biopsy. So all these are the different methods done for the diagnosis of the condition. Papillomas known for recurrence but rarely undergo malignant change. Wherever there is papillomas present, they are more prone to recurrence. But the good thing is they don't have a cancerous transformation or malignant transformation do not occur in the papillomas. Treatment is microlaryngoscopy, carbon dioxide laser excision procedure repeated many times. Tumor removal with cup forceps or debrider under microscope, so it's debrided or removed. Medical therapies used as adjuvant therapy. Interferon alpha 2A gives promising results, and 13-cis retinoic acid used but has some side effects. So all these are different medical treatments used for the condition papillomatosis. We have alpha 2A, interferon alpha 2A, and 13-cis retinoic acid. Then adult onset papilloma. You can see the wart-like papilloma here, the picture, usually single, smaller in size, less aggressive, no recurrence after surgical removal as compared to juvenile polymatosis. Arises from anterior half of vocal cord, anterior commissure. Common in males 2:1. Treatment same as for juvenile type. So that was all about the final section of our topic, benign tumors of the larynx, in which we discussed in detail the non-neoplastic, neoplastic tumors. In the non-neoplastic, we mentioned that it's solid non-neoplastic and it's cystic non-neoplastic. In solids, we have different types of tumors or growth, and then in the cystic, we have also ductal, saccular, laryngoscope. Then we also mention about the neoplastic growths, and then very two important terms we talked about in this lecture also about the vocal nodules and vocal polyps that can occur as a result of vocal abuse. So all that we covered in our today's lecture. Thank you for watching sqadia.com.